and welcome back, Free From an Allergy community. I'm so excited for this session. So, I'm going to welcome Jane Muir, who is the Associate Professor and is currently the Head of Translational Nutrition Science in the Department of Gastroenterology, Central Clinic School, Monash University. Bit of a tongue twister there. She is a trained dietitian with a PhD in biochemistry and has over 25 years' experience in the area of nutritional research. Over the last 15 years, her major focus has been on the research and creation of the Low FODMAP diet. Now, I know a lot of our community has shown a huge interest in FODMAP diet, so I'm excited to introduce this session. Jane will be taking us through how you can actually understand the Low FODMAP diet and how this can actually help manage your gut symptoms, plus hints and tricks on surviving Christmas. So welcome, Jane.
Hi, thank you very much, Lauren, and hello everyone. I'm delighted to be here, and I have to straight away apologise for a typo in the title there. I obviously did that late at night, but today I'm going to talk a bit about an overview of the problem of IBS, which is a very common problem in our community, a little bit of an overview of the Low FODMAP diet, hopefully answer many of your questions that you might have, and I'll be happy to answer them at the end as well. And also maybe some hints of how to survive Christmas, which is nearly upon us. So I'll just go to my first slide here. We're talking about gut reactions, which of course is really IBS or gastrointestinal symptoms, which is a real common problem in our community, not just in Australia, but worldwide. And it basically, most of our patients who present to our clinics with terrible abdominal pain and discomfort do talk about foods, certain foods, and foods as a major trigger for those symptoms. So we're going to talk a little bit today about really what's in foods that can trigger these symptoms and how we can use our knowledge about diet to reduce the impact that certain foods have on us. So the health problem we're talking about here is something called irritable bowel syndrome, or IBS. And it's a very, very common problem. And the symptoms of IBS, it's a symptom-based problem: abdominal pain, bloating, distension of the gut, and change in bowel habit. Bowel habit can actually oscillate between diarrhea and constipation. It can be mixed. So it's actually a lot of gastrointestinal distress and discomfort can really affect our day-to-day lives. I think I've just lost my clicker. Sorry. Can I have the next slide, please? Something's happened to my clicker. Oh, no, here we go. It's gone. Right, I've got it back in. Okay, so the health problem of IBS, it is, as I said, the most common gastrointestinal complaint that we see in our clinic. In fact, really half of our patients presenting with gut symptoms or gut reactions will end up with this diagnosis of IBS. It is a very common problem in our community, so if you suffer from this condition, you're not alone. It affects 1 in 7 adults in Australia, so it's a real problem in our community. It affects women more than men. So women are twice as likely to have IBS as men. So women are more likely to present in our clinics as well. The causes of IBS are complicated, and we don't really understand all the causes. It seems to be many factors involved in IBS, the development of IBS. There can be things like very mild inflammation of the gut. There can be disturbances or changes in gut motility. There can be alterations in the gut microbiota. So this is the bacteria that live in our gut, can be different can be affected and changed and different to a healthy person. But also, and very importantly, there's this what we call visceral hypersensitivity. So people with IBS are just very, very sensitive to distension and bloating of their gut. So they really sense pain when their gut is bloated. We call this visceral hypersensitivity. It is a significant factor in our lives, IBS. It really does reduce the quality of life. And a survey that was done a few years ago with people who IBS, actually they said that they would actually sacrifice 10 to 15 years of life for an immediate cure. So we know it has a major impact on quality of life. And anything we can do to help alleviate that is terribly important. As a result of affecting the quality of life, it's got economic burden, of course, is very high because people can't attend work, people can't attend school, or they can be at work or at school, but they're just not operating at their best. They're not at their best. So it's very important for us to find therapies to help people manage this condition. There's no drug, there's no quick fix for this condition. So, as I said, it's complicated and it's no simple fix. We do know, and our patients have told us, however, that up to 80% will claim that foods trigger their symptoms. So if you've got this condition, you will know that after eating certain foods, you'll have some symptoms. And a huge range of foods have been implicated. It's not just one food. So it's been very, very difficult to tease out and identify what are the culprits in our food that might be responsible for triggering these symptoms. So the candidate dietary triggers that our team at Monash explored included these compounds, these carbohydrates called short-chain carbohydrates. The short-chain carbohydrates include, and why we were interested in these particular carbohydrates is that they fit a lot of the characteristics of the sorts of things that might be triggering symptoms. So they're small and they're osmotically active. They can pull water into the gut. They can be rapidly fermented by bacteria and they will produce gases. So these sorts of characteristics of these short-chain carbohydrates makes them a very good candidate for us to study. And so that's what we did. In fact, if you look at the history of these short-chain carbohydrates, we've actually known a fair bit about them for many years. And this just sort of gives a little bit of a background over the history, going back even to the 1960s, where the work started to come out about lactose, for example, as a milk sugar. Reports about it stimulating, or triggering symptoms in some people were published. And all the way through the 70s, 80s, more recently, we've got various sugars, these short-chain sugars, which have been responsible for triggering gut symptoms. Essentially, all of these sugars, if you like, the lactose, the fructose, the sugar polyols, the fructans, the galacto-oligosaccharide or GOS, were all candidate sugars for us to look at together as a group. And the term FODMAP was really just a way we could really package them all up together under one umbrella term and actually study them as one group as a whole. So the term FODMAP really allowed us to do that. So what do FODMAPs stand for? What are FODMAPs? So FODMAP stands for, the F is for fermentable, the O is oligosaccharide, the D is for disaccharide, M for monosaccharide, and P polyols. So what are oligosaccharides? Well, they include fructooligosaccharides, fructans, FOS, galacto-oligosaccharides, GOS, and these are found widely in things like onions, garlic, wheat, rye, barley, legumes or pulses, and some nuts and seeds. Disaccharide, which are really two sugar units, include lactose, and of course lactose is found in milk products, yogurt, ice cream and custard. Monosaccharides include fructose, which is found in honey and some fruits such as apples, pears, watermelon, mango, asparagus and snap peas. And that is fructose in excess of glucose, that's fructose. And sugar polyols, the most common ones found in our food supply, are called mannitol and sorbitol. Now, mannitol is found in vegetables such as mushroom, cauliflower, snow peas, celery, and sorbitol, which is found in fruits, include apples and pears, blackberries, and also added as an artificial sweetener, often in gums. So here we have FODMAPs. Now you know what that stands for, but it's an umbrella term, and it really allowed us to package up all of these sugars into one package, if you like, and study them as a whole group. So they are found very widely in food, and you can see here that they are naturally present in food, and they are widely present in food. And some foods will have more than one FODMAP type. So they're in our diet, they're everywhere, and they're there at different levels in a wide range of foods. At Monash, we've done a lot of work on the analysis of FODMAPs in foods. This is very time-consuming, expensive business. It really is a specialised area of carbohydrate research. It takes a couple of weeks to take one food all the way through the various different tests that have to be done to track all of these different sugars in foods. It involves a number of different types of equipment, HPLC, different HPLC columns and so forth. So it's actually quite a difficult process, but we have done that. We've built up the largest database in the world now of FODMAP composition of food. Because we were studying in this area, we really had to define what was low FODMAP and what was high FODMAP. And we established these cutoff or safe levels, if you like. And we based these cutoffs really on our clinical experience initially, working out with patients really the sorts of levels of FODMAPs we felt that they were able to tolerate and levels that they were not. So we developed the low FODMAP, these cutoff values for each of the FODMAP sugars, and you can see them there. And we use this as a guide to help design dietary studies to study the low FODMAP diet in our patients to see whether it was going to be effective in controlling their symptoms. And this work has been published there, I think both references there. So if you look here at this slide, we can see that there are a number of things actually. You can see that in these different food groups, you've got breads, cereals, vegetables and fruit there, that you have FODMAP containing foods of different levels. So you have, for example, in each group, you'll have really a high FODMAP containing food and low FODMAP containing food. And many of those foods contain more than one FODMAP. So for example, for rye bread there at the very top, you see it's actually very high. It's a very high FODMAP containing food, and it contains a number of different types of FODMAPs. It includes, largely fructans. It's one of the major FODMAPs, but it also has other FODMAPs. And you can see that even though rye bread's very high, there is a low FODMAP choice there. There's spelt bread, and then there's a gluten-free bread, which are low FODMAP. So as you go through all of those different food groups, you can see that in each group there is a high and low option for you. And you see our little cutoff level. So you can find some low FODMAP options there. And the key principle of the low FODMAP diet is actually to replace high FODMAP food with a low FODMAP food alternative. So you're still in the same food group. You're not eliminating foods from the diet. You're not on a highly restricted diet. You've simply exchanged a high FODMAP food for a low FODMAP food. And of course, we use the Monash Fodmap app contains all of our knowledge in this area. And if you've been advised to go on a low FODMAP diet, this is a really essential tool for you to follow the diet. It's been updated all the time as we test more and more foods. I'll talk a little bit more about that later. But by understanding the FODMAP content of foods, of course, we've been able to develop low and high FODMAP diets that we use in our studies and in our research to show the efficacy of this diet in controlling symptoms associated with IBS. And their diets, we can see that they're well balanced. They've got members of each major food group. You can have a very good diet on a low FODMAP diet, a nutritionally balanced diet. So the evidence for the efficacy of the diet, there's a number of studies have been done now. We did the first feeding study, the first study, and it was a number of years ago to show that the diet was effective, and that was published a number of years ago now. And that was showing that the diet really was effective at lowering the symptoms in people with IBS. But really subsequently, our research has been reproduced in countries all over the world. I think there's about 14 studies now worldwide. So there's a very strong scientific evidence base to the low FODMAP diet in managing symptoms of IBS really around the world. So you can see it's been used in countries. It's been recommended as first-line therapy. It's highly effective, so 3 out of 4 patients with IBS will have some relief from their symptoms by following the low FODMAP diet. And this is an example here. This is a study we did a number of years ago in people who had IBS, and this was actually measuring gas. The gas production in the bowel from the bacteria. The bacteria work on the carbohydrates, producing gas. And so the high FODMAP diet produces a lot of gas. You can see actually the gas is produced over the day. And often patients would say that they feel really worse later in the day towards the evening. And that's because of this buildup really of gas. But you can see there the green, the low FODMAP diet, there was much less gas produced and they were much more comfortable. So that's just sort of visually showing one of the major ways the diet works, is reducing the amount of gas that is generated. We've also produced little animations. There's something on YouTube, but I've got a little more simplified animation here to show how FODMAPs trigger symptoms. So the blue is the FODMAPs really traveling along the small intestine. They get into the large bowel. They're small and they're osmotically active, which means they pull water. They can pull water into the gut. And because they arrive in the colon, and the colon is full of bacteria, so all those black dots are bacteria, and they love FODMAPs. It's just, they love them. That's just wonderful food for them. So they will ferment them and metabolize them and produce gas as one of the major byproducts of that. So you've got gas production, you've got water production or water pulled in, and all of these things together helps to distend the gut. It can change motility, which means you can have diarrhea. Some people have diarrhea, but certainly you have pain, the bloating, distension, wind, and even constipation. So it's this action, the FODMAP action. This is the major mechanism of how we think the FODMAPs trigger symptoms in IBS. So why do people with IBS feel pain? So this is where it's terribly important to understand there is a difference between someone who doesn't have IBS eating a pear there on the left to someone who has got IBS and eating a pear on the right. The pear is very high in fructose and sorbitol and is a major trigger for symptoms in people with IBS. The reason why the person with IBS has symptoms is they have this visceral hypersensitivity, so they're highly sensitive to this distension of their gut, so this stretching and bloating of their gut, which is produced as a result of the FODMAP in their gut. So that communicates to the brain. There's a real chatter going on between their gut and their brain, and they feel terrible discomfort and pain. There's another area which is very interesting. It relates to gluten and FODMAPs. There's a connection there which I'd like to explain to people. So the question is it FODMAPs or is it gluten that triggers symptoms? And people who are gluten sensitive but don't have celiac disease. So people who have celiac disease is a very, very strong, well established that it's gluten is the cause of that. And there's around 1% of Australians have celiac disease. But there's a lot of people who feel they're gluten sensitive. So is it gluten sensitive? Is it gluten or is it FODMAPs in these people who do not have celiac disease? So something was very interesting when we started to analyse a whole range of foods for FODMAP content. We identified that actually gluten-free grains, and you can see them there on the left, tend to be low FODMAP. So by choosing gluten-free, people are actually choosing a low FODMAP diet, which may explain really why they do feel better on the low FODMAP diet. In fact, now there's been a number of studies to show that it's actually not gluten, but it is rather FODMAPs that is probably the problem in people who have so-called gluten wheat sensitivity. So that's just something to bear in mind. And here's another example. You can see there that the gluten-containing grains and cereals have higher levels of FODMAP. So FODMAPs travels with gluten. So by going gluten-free, you're selecting a low FODMAP diet. So what does this mean? It means really if people have got gut symptoms to wheat and they don't have celiac disease, it's possible that the FODMAP and fructans, and it's not gluten, is responsible. They're probably going to get more relief by going low FODMAP diets. They really need to talk to their dietitian about that. So let's talk now about how to implement the low FODMAP diet. It's very important to firstly confirm your IBS diagnosis with your doctor, because if you're having these gut symptoms, you really need to have them checked out by your doctor. There's a number of reasons why, for gut symptoms, there can be more serious conditions that will have similar symptoms. So please go and have your symptoms checked out by your doctor. And the doctor will make a diagnosis. And if it is irritable bowel, then they will refer you on to a dietitian with expertise in the area. And there's actually 3 important steps to the diet. So the diet is, it's a learning process. It's a learning diet. It's not a diet for life. It's not a strict diet for life. It's a learning diet. And there's three important steps to it. And the idea is that you're basically going to learn about which are your particular FODMAP triggers, where they're found in food, how much can you tolerate. And a dietitian will coach you through these 3 steps. It's very important you have a coach, someone to help you. So the first step is step 1 is the low FODMAP diet, which is only followed for 2 to 6 weeks with the help of a dietitian. And that's when you restrict your intake of FODMAPs by swapping high FODMAP foods for low FODMAP alternatives. And that goes for 2 to 6 weeks. And really to see whether FODMAPs are responsible. So the dietitian will help interpret the results, but help you through that process. Everyone is different. It's important to note that everyone's different in which particular FODMAPs that they respond to. So that's why it's such a personal journey for people. You have to work out really what your triggers are. The first step is reducing FODMAP. So hopefully that's worked for you. And then the second step is the reintroduction, where each FODMAP sugar, one by one, will be reintroduced over a 3-day period at increasing doses. And we use food that are high in those FODMAPs to do this. And you work out by keeping a diary whether or not that food or that FODMAP is a problem for you, what dose you can tolerate. So it's basically, this is where the real learning comes in. The dietitian then, step 3, will help you interpret all of those results, and then only you need to restrict your diet for those particular FODMAPs that are affecting you. So really it's trying to not restrict your diet unnecessarily, and to reintroduce all the foods that you can tolerate at the doses you can tolerate. And it's also because you're learning so much, you feel confident in challenging yourself. And it's sort of a continual process of challenging yourself because your sensitivity will change over time. So you need to keep on challenging yourself with the FODMAPs just to see whether or not you still are sensitive to them. So it really is important to think of this as a learning process, not just a list of foods that are high that you can't have. So it's learning. And a dietitian is really key here. So Monash have really worked hard to develop resources to help patients and health professionals working in this area. We have the app, but we also have our website, which has lots of blogs and useful information, lots of recipes. I think there are Christmas recipes on there as well. We have training courses for dietitians, and we have one for patients now, which we released about a year ago. We have booklets. So we really have tried our best to put information out there. We have a very active social media community, really, as well, if you're interested in looking at that. Our Monash app, however, has been the to-go resource. It's downloaded in 130 countries now, and it is being used really worldwide, obviously, to help people manage this condition. It has a lot of information. The app is full of valuable information. So I really do recommend, if you are interested in this area, if you've been diagnosed with IBS and you want to follow the Low FODMAP diet, to download the app. It's around about $10. It's a one-off payment, and the money does help us with research and ongoing analysis of foods. But you can see here the food guide, which is really where all of our results go, and we're the only people in the world doing this amount of testing of FODMAP containing food. So it's the biggest database in the world. So to access it, really you need the app. So the food guide is there, but we have recipes. You can find a dietitian. We have a diary to record symptoms. And we also have been working with food industry to certify low FODMAP foods. So there's lots of foods available in the supermarket for you to choose from that are low FODMAP and safe for you. So I recommend you looking at that app. So just the step one, which is really important step, using the food guide. And basically the app is using a traffic light system, a simple traffic light system to help you identify high and low and moderate containing FODMAP foods. So during the first step of the diet, you'll be looking for the green serves of food, which means go. These are low levels of FODMAPs. So you're swapping your red for the green. And you see in the app, when you open it up in the food guide section, for example, here's fruit. We're clicking on fruit. You'll see avocado is actually a red food. Its overall rating at a typical serve is red, but you can actually see that there may be, often there's a safe green serve of even a red food. And if you click on avocado, you get a lot more detailed information. You see there on the right, and there may be a safe serve of a red food. For example, avocado, I think it's about 1/8 of an avocado is actually low in FODMAP, so it's safe for you to have. So it's really the quantity of food that you're having as well is terribly important to understand. It's how much of these foods you're eating. And as I said, we are working with food industries in Australia and all over the world to develop low FODMAP products so that our patients have some low FODMAP, wonderful food to select from, which are low FODMAP and safe for them. You can find those listed in the app. And just look for this little logo here on your products. So in summary, 1 in 7 people in Australia have IBS. It's a really, really common problem. It's important not to feel you're alone in this. It's a very common problem, and there's definitely help out at hand there for you. Certainly there's evidence that low FODMAP diet works, and we have a lot of expertise in Australia around this diet. 3 in 4 will actually benefit from the diet. The other thing to note is that people who follow gluten-free, but they don't have celiac disease, may also benefit from the low FODMAP diet. So it's probably, again, talk to your dietitian about that. It's important to not restrict gluten if you don't need to. And I guess the other thing that I get told by people who have IBS and think they're gluten sensitive, that we say, well, actually, you're not gluten sensitive, it's actually FODMAPs, and you can actually have some nice bread. You can actually have a gluten-containing bread. I think that sort of people are very pleased to hear that. And please look out for the FODMAP category in supermarkets. Look for the icon, our icon, for looking for safe low FODMAP options for you. Now I've got a little bit here on Christmas special here, because at Christmas time, fundraise. I've mentioned that. It raises, helps us out with research and more testing. So here we go, surviving Christmas special. I'm going to just end on a few little hints here. This is something we get a lot of questions about. And we've got 7 essential steps here to survive Christmas. Number 1 is to plan ahead. And I think just preparing low FODMAP meals and freezing them so that you've always got that option there. Especially when things get busy, it can be really hard to grab something and it's not the right thing to grab. So if you've got something in the freezer, that's really, really a good little hint, a little good idea. Make sure you do snack right. Try and avoid greasy things because fat can actually exacerbate symptoms. Keep snacks small. And again, usually when you're out and about, hopefully there's some low FODMAP options there. Use your app and just be careful how you're snacking. Keep things fresh, so make sure there's raw vegetables that are safe, low FODMAP fruit that are safe. Make sure that there's some side dishes there that is appropriate. It's all in moderation, of course. Alcohol is another trigger, so fatty foods and alcohol also can trigger. So again, just keep that in moderation and be aware of that. Hydration is terribly important, so drinking lots of water as well, not too much coffee, because coffee can also be another trigger. So drinking lots of water. Exercise is terribly important, of course. It helps us manage stress, and stress is a trigger. So stress is a trigger for IBS symptoms. So it's important to build exercise into your diet and build ways of managing your stress is very, very important. Around Christmas time can be very stressful. So resting up, make sure you have time to step back and relax and find stress management strategies that work for you. Very important to monitor and look after yourself so things are not too stressful. So that's it from me. So I'm wishing you all a very happy Christmas from the Monash Fodmap team. It's been a funny year. I'm hoping 2021 is so much better. Please do come to our website because we do have a lot of Christmas recipes that are available there. So it's monashfodmap.com and hopefully you'll get some hints there what you can cook over Christmas that's low FODMAP. So that's it for me, Lauren. Thank you.
Thank you, Jane, so much. I do have a few questions that have come through. One question is from Larissa, and she asked, is it more common for patients sensitive to FODMAPs to develop symptoms gradually at an early age or sudden onset sensitivity in adulthood?
Okay, that's a very interesting question. I think it's probably a bit of, it actually can happen both ways. So it can happen suddenly, and often it's reported, we call it post-infectious IBS. So this is after a bout of gastroenteritis, is often when people report the start of a problem. Now that can actually happen as a young person, it can happen as an old person. So that's often when people report the start of their trouble of IBS. But IBS type symptoms can occur very early, and they can occur late. But the most common sort of age group is actually women between the ages of 20 and 50 when we see the biggest number of cases there. It may well be people put up with some discomfort for a long time and not really reported it to their doctor. I think that's also there. But it can happen gradually, it can happen suddenly. But
I guess
stress is very important to manage and worry. So I think you can do a lot to reduce your stress. There's definitely an interaction between the mind and the gut. The gut communicates with the mind, and so if there's stress, it can affect your bowel habit and symptoms as well. So it's important to keep that in mind. Reduce your stress.
so. With stress as well, can that also, I understand that it can affect our bowel movements. Can it also then affect the bloating? So that's why all of a sudden you get that big bit of air, I guess, in your stomach and the discomfort.
Mm, mm. Yeah, because it affects gut motility, and absolutely, it can be quite sudden if you have a sudden stressful event. I
Right.
mean, the most common ones we find are students sitting exams, and then we also find athletes just before they go out into a perform or something like that. A long run or something. There's a mad dash to the toilet. Then so that's a stress response. And that is natural. And that's part of the fight or flight response. But you don't want that going on all the time. You don't want that sort of response going on at inappropriate times. So that's why it's important to manage the stress.
Perfect. I do have another one. So Kanda has asked, how long would you follow this diet if you were showing no signs of improving? I know it's 6 to 8 weeks if improvements before you move to stage 2, but she also understands that sometimes it might not help people.
No, that's a very good question, a very important question. You need to go back to your dietitian if you feel that the diet is not working for you. You need to talk to the dietitian and discuss it. They will check to see that there's not hidden FODMAPs in your diet that you've missed, and just make sure that you are on the diet. Now, it doesn't work for everyone. So really, if it's not working for you, then they will reintroduce FODMAP, so just tell you to go back to eating normally. Often we find when people do that, they do start to get symptoms. So the diet was actually working, but, not completely. So you really have to go back to your dietitian. If it's not working for you, there are other therapies. There's other things to try. There's no point in staying with a diet, a restricted diet, if it's not necessary, if it's not doing anything with you. So it's very important to go back to your healthcare professional and discuss it. But you should not be on the diet if it's not working for you. You should be trying other therapies, and there are other therapies out there which can help.
Yeah. Another one has just come through as well. Why does it affect women more than men? Is there research behind that or a reason?
Yeah, it's a good question. And I'm not sure that we know the answer. It can depend on cultures a bit. It might depend on that women may be more happier to present to the doctor and discuss these sorts of issues. Men just sort of tolerate them. I don't know. I think it's sort of complex, actually. There certainly are some women, for example, with endometriosis, which is another common problem. And there's often an overlap with IBS symptoms and endometriosis. So they have IBS symptoms and endometriosis. So there's also some women, there's definitely a hormonal, cycle effect. So I think that there's probably some hormones in there as well, maybe some other conditions, but also a combination of women wanting, presenting and trying to find solutions for this, not accepting the bloating and the discomfort. So it's a complex thing, and it's no one answer, but it is just something we've observed. And women are much better at volunteering for studies too, which is interesting. So most of the research we do is on women because
Yeah.
they present, they're happy to help with the research. It's been terrific.
Is there also a common link with PCOS and FODMAPs? Like I know you just said endometriosis, but has there been any linkage with PCOS?
I don't know of any. But I think that the diet's been used in a range of other, it's going to be used in other medically diagnosed condition where there's a concurrent IBS. So IBS symptoms are going along with that condition. So there's inflammatory bowel disease, for example, which is managed through medication, and the low FODMAP diet's not going to cure IBD, but often there's IBS type symptoms which are going along with that condition, and those symptoms can be managed by modifying FODMAP intake. So I know that is being used. There's also colic in breastfed infants. So exclusively breastfed infants who have colic. Now that's sort of that's a condition that it's very self-limiting. So it really is only for about the first 3 months of life, but it's quite distressing for the mothers, parents to deal with colicky infants. But we have evidence now that changing the diet of the mother, so the mother not eating high FODMAP foods but having a low FODMAP diet just for that period, helps to settle the infant, and there's less crying time. So there's other interesting areas where the diet's been used. I know it's also been used in helping endurance athletes too, who have got sort of like often a severe gut symptoms during events, endurance events and things like that. So they're using the diet there. So it's been used in a number of places, and we certainly need more research to show how it can be applied. But it's very important to work with a health professional before you go changing your diet.
Definitely. Another question has just come through. On the Monash app, who creates the recipes? Are they Monash credited dietitians?
Yeah, we actually have got, we work with chefs. We've had research chefs over the years. So, and also the dietitians develop the recipes. So it's the Monash team, which includes research chef and dietitians have developed the recipes. And the recipes in the app, there's lots there, but there's also a lot on our website that are, you can just go at any time. It's all free. There's heaps of recipes there on our website to look at, but that's all been created and checked by the team to be low FODMAP.
Perfect. Well, I think that's all the questions today. Thank you so much for your time today, Jane. We really do appreciate
Okay,
it.
you're welcome. Yeah.
And if people want to find out more, how can they find you? It's just on social media on Instagram.
I think, yes, Monash FODMAP hashtag. I'm actually not quite sure. You might know more about this one than I do, but we do. You put the links up, yes. But the Monash FODMAP team, we have a whole team that look after social media, and they're terrific and, very active on there. We've built a real community, and it's a worldwide community. It's people from all over the world come to really a safe place where the information is accurate and correct, because there's a lot of information out there which is not accurate and correct and not based on science. So you can come and get good information. And what we do is we get lots of questions. If we find the answers, we will write a blog about it so people can read it in detail. We have hundreds of blogs also there, always answering the many questions we get from people. But it's a real community, and people share experiences. And we just try and keep everyone up to date with all the latest information. So it's a worthwhile place to visit if you're interested in this area and trying to manage this condition.
Definitely, and you can also find Monash Fodmap in our exhibitor area in the Buy Now section. So if you click onto there, their programs are there for patients as well as dietitians, and you can click through. So thank you again so much for your time today, Jane.
You're welcome.
It's been amazing.